What's up, guys? Real quick, I want to touch on something that's very common to females, especially adolescent females, which it can occur for anyone at any age, but it's very common to adolescent females, is where the kneecap tries to sublux or track laterally to the outside of the knee, and it can dislocate. And this is common in females because the vastus medialis, or the inner portion of the quad of the thigh, becomes weak, and the vastus lateralis on the outside of our thigh is very powerful and it's very large. And so they both connect to a common tendon, the quadricep tendon right here, just above the kneecap. See, this is a quadricep tendon, and they both attach there. And so mechanically, there's more line of pull that's pulling the kneecap to the outside. So sometimes it doesn't take much to cause this kneecap to ride on the outer edge, and then it can pop out, can sublux where it's partially out, or completely dislocate, and you've got to get that back in. And the trouble with that is it irritates a lot of times cartilage on the underside of the kneecap, and or in the groove that's just underneath this that the kneecap sits in, the trochlear groove. So that can cause some issues, and sometimes it can be a little tricky to resolve. Because the athlete, a lot of times it's an athlete, cheerleading, dance, very common in dancers, gymnasts, and so you have to really kind of mitigate that as far as monitor workload management, keeping them in their sport or whatever that is that they're doing, and then also treating it to try to reduce the symptoms that are going on. So if you know somebody that happens to, like I said, it is correctable, and a lot of times doesn't require surgery, although if it's left, you don't do anything about it, then it can require surgery later on. We have to have a release, and there's a whole thing that surgical procedure that has to be done. But in most cases, if that's happening, someone, you have a child or someone that's the kneecap keeps riding the outside, feels like it wants to pop, they bend down, stand back up, then a lot of times you want to have that addressed and looked at by healthcare professionals. So that's a little bit of subluxing knee, also known as J sign, where the kneecap tracks to the outside. So I hope that helps. And like I said, if you have any issues with that, make sure and have that checked out and don't let it rock on. So thanks so much, guys.